歡迎大家。
Welcome to the media briefing today. Today we have Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Linda Yu, Chief Manager of the Hospital Authority. Dr. Zhang will first tell us the situation today. Last night we have confirmed 60 cases. The case numbers are 11152 to 11211. Among the cases, 6 were imported, including one case with 501Y strain of the virus. There are also 5 local cases and 49 cases with links with previous cases. Among the 60 cases, the age ranged from 12 to 65, 32 males and 28 females. For the 49 cases with links, 47 are related to the Ursus Fitness Center, including 40 customers who have been to the gym and 7 close contacts with the customers or staff members of the gym. The 47 cases, some of them have been sent to hospital from quarantine center. Some of them already presented with symptoms when we approached them. So far, we have 64 cases related to the gym. 7 are staff members, 50 are customers of the gym, and 7 close contacts. The patients with the earliest onset was on the 6th of March, and some had onset on the 10th or 11th of March. For the 5 local cases, they include 1 student, which I have mentioned yesterday, studying in Pak-Tin Catholic Primary School. The school will be subject to compulsory testing. The student lives in Diamond House, Nam Chang Street. He also has a family member who is preliminary positive. The second case is the security guard working in Fujak House, Chakon Estates, living in Fok Wing Street, number 13. This is the same building with number 15. The security guard's residential address and also the building that she works in will be subject to compulsory testing. And there is another housewife among the cases. She lives in Waging Sanzhong, Block 11. A friend who has had meal with her is also a confirmed patient. There is a case which was not mentioned yesterday, who works in Kowloon Bay, Wang Chiu Road, Keiyip Guangcheng, Phase 2. He last worked on the 1st of March. The case is so far untraceable, so the workplace will be subject to compulsory testing. The patient lives in Lam Tongou, Block 5 in Sai Kung. During the incubation period, the patient only had meals with family members and had rock climbing with friends and family members. Another patient lives in Shengming House in Shengdak Estate in Shangguanou. The patient works as an attendant in the exhibition in Changguanou Center. During the incubation period, the patients did not have any particular activities. We have some 20 preliminary positive cases and a few untraceable cases. Many of those cases are related to the Ursus gym goers. The first one untraceable so far is a 41-year-old male. He works in the maintenance department of the Hong Kong Sanatorium Hospital. He doesn't come into contact with patients. He lives in Hayley Building in Nathan Road. He has no symptoms. 1 week ago, his test came back negative. Now he is tested preliminary positive. The second patient is also a gym coach or a fitness coach who is yet to be confirmed to have relation with the Ursus Fitness Center. He works in 1PT as a private coach, fitness coach in H-Core. There are close contacts and colleagues who need to be quarantined. He lives in Lohas Park. Another case is a 34-year-old lady. She is not working at present. She just gave birth recently. She lives in Choi Yi Fa Yuen, Block 3 on Choi Hong Road. She had no symptoms and she had a test on the 9th of March. In Queen Elizabeth Hospital, she gave birth to the baby on the 4th of March. On the 5th, 8th and 10th of March, she had been to Nam Tin Maternity and Child Health Center. She had been tested negative in Queen Elizabeth Hospital later. However, she was worried, so she got a test again and was tested preliminary positive. We will follow it up with the Maternity and Child Health Center concerning the case. And also, there has been an outbreak in the gym in the past 2 days where other fitness centers are involved. That's why the FHB is going to issue a compulsory testing notice to workers at gyms. They have to be tested on a compulsory basis before the 14th of March. Those who have conducted a test will not be counted. And also, I would like to remind the public, we have traced a lot of workplaces and family members during this outbreak. I urge members of the public to cooperate with us, especially for persons in charge of businesses. We need floor plans, seating plans, and staff contacts and numbers from you. I hope you can cooperate with us, because this is the requirements under CAP 599D, the Prevention and Control of Disease Ordinance. That's all for my report today. Thank you.
Good afternoon. As of 9 a.m. in the last 24 hours, the HA system had 43 reported cases, and in the last 24 hours, there have been 16 patients who recovered and have been discharged. So far, we have 10,710 patients who have been recovered and discharged. 206 patients are in 11 hospitals and AWE community facility receiving treatment. 13 of them are in serious condition. 113 are stable, and the negative pressure rooms are 1,214. Usage is 57.1%, and we have 675 negative rooms, and the usage rate is 63%. And there are some 2 items I need to report. This morning, the AWE patients will be transferred to Northern Langtao Hospital, and this transfer has just been completed. Starting from tomorrow, the community facilities will be held in standby, and if necessary, we can deploy these facilities to receive and treat patients. And as of November 25th last year, when we reactivated the facilities, we have treated more than 3,000 patients. Some 2,200 patients had recovered there, and the remainder, they had different clinical reasons and were transferred to a hospital for treatment. The community facility has relieved our quarantine facility pressure, and after the patient's recovery, they were able to receive treatment in our regular hospitals. And on behalf of HA, I would like to thank staff working in the community facilities. They've been working very hard to take care of patients. Without their assistance, the community facility operations would not have been so successful. From tomorrow on, the Hong Kong Infection Center will take over and handle patients with less serious symptoms. And regarding PPE inventory levels, currently our surgical mask inventory level is 100 million. We have 8 million pieces of breathing equipment. We have PPE of 18 million pieces, and it is good for some 6 months. So please raise your hand and also introduce your media outlet. Ming Pao, I want to follow up on the gym situation. Just now, Dr. Zhuang mentioned that the earliest confirmed case was on 6th of March. Is that the 27-year-old male gym coach? Is that the case that you've been able to track down? And aside from 3 other gyms, were there any new gyms discovered today? Have Ursus customers been to other gyms? Did they teach or take lessons anywhere else? The second question is, you said that there is a preliminary case from a gym coach from one PT. Could you give us his age, his their sex, and how many students they have taught, and how many people need to be sent to quarantine, and how many preliminary cases are related to Ursus? The third question is about Dr. Chuang. You mentioned you urge that company owners cooperate and give you floor plans and name lists. So are there companies or enterprises that are uncooperative, that don't provide information and hinder you from tracking down confirmed cases? The patient discovered on the 6th of March is a customer. We don't know whether if they are the source of the outbreak, or whether we have just only found a patient who had developed symptoms at an early stage. The gym, there are other gyms. Other gyms have been visited by patrons. For example, Ultimate Fitness Studio in Sai Ying Pun, Pure Fitness in Central, Pure Fitness in Wan Chai, H-Core in Tai Kuxing Central, Optimum Performance Studio, HIT Fitness Central, Strength Culture, House of Fitness Seongwan, Athletic Club on Wellington Street, Pure Yoga in Central, and Lincoln House. So not all of them were from one source. A lot of these customers like going to different gyms. The one PT patient is a female, 34 years old. She had a dry throat, and previously on 8th of March she did a test that was negative, and 11th of March she did another test and was preliminary positive. There are some 30 colleagues working together, and there were dozens of students, but we have to check the timetables and whether they were whether these occurred during the infection period. And the last date of work was 10th of March. Now, because we haven't found the source, we will trace it back 7 days before infection. So the Ursus outbreak, we have not been able to identify the source. So there might be some invisible cases. And in the past we had people without symptoms, so we don't know when they were infected. In the past, we would have to trace related cases for 2 days, and on this occasion we'll have to trace 7 days, because these people might have been to the gym 3-4 days prior to being confirmed. Aside from cases that have no identified source, we have imported cases, some 10 plus cases. The majority of them are related to URSIS, and of course some of them might be related to other cases. We have a lot of cases where people are going to work, and we want the details as soon as possible and whether they need to be quarantined. So of course we would like them to cooperate. Next, Hong Kong 01, the gym outbreak. Would you consider that as the 5th wave? Is it a repeat of the dance group previously? What are the similarities and differences? And I want to ask Dr. Zhuang, roughly, how many cases are undiscovered and how far will it spread? And compared to 14th of March, where we have the mandatory quarantine testing, so if the public have been to the gym, will they need testing? And has the mobile app Leave Home Safe played a role in identifying cases? Well, I don't want to see this as the beginning of the 5th wave. We'd like to keep it under control, but since it involves a lot of people and in a very short period, so we've seen a lot of new cases in a short period of time, and so the gym might have been spreading the virus for some time, and we see that from first contact to infection, this might occur over 1 or 2 days or 3 days. So we might have a few generations of spreading of the disease, and if there has been members of the public should be vigilant and should take testing if they've been to the gym or on the Hong Kong Island. So the gym, they have a list of customers, so they were able to provide that information very rapidly, and they also sent emails to customers, so they were urged to undergo testings. So as soon as we started to investigate, we could identify cases and we could quarantine them. So the gym, they have these records, which is very helpful. Leave Home Safe, people are very active. They might not recall where they went on which day, and if we look at their records, we see that you've been to a certain place on a certain day. Do you remember that? Who did you go there with? That would help us. And we will also relay that information to related people, so the public can be aware that they were at risk.
Next question, please. The lady in stripes at the back. Hi, I'm from Apple Daily. A follow-up question on the URSIS Fitness Center cluster. Among the confirmed patients, were there anyone who had contact with other clusters? For example, the Mr. Ming Chinese dining restaurant cluster in K11 or the Causeway Bay cluster? Have they been to these restaurants? Now, altogether, how many people have been traced from the cluster of URSIS? You said there were 7 staff members. So are they all coaches or are there any receptionists? And what was the infection method did they share the shower room or because they share fitness equipment. Now, it was said that for each case, 100 close contacts have to be traced. So, is the CHP able to do that? So far, we have not found any cases relating to Mr. Ming Chinese dining and Hoi Zhan in Causeway Bay. The 7 staff members include receptionists. However, those receptionists also used the gym room. So, concerning the infection method, it was human-to-human transmission. They did not all go to the gym on the same day. However, many of them went repeatedly. Some enrolled in one-to-one classes. Some were enrolled in group training involving some 10 people. Many of the customers did not wear a mask, and the activity was very intense, so it caused transmission. As at yesterday, because of the Ursus Fitness Center, 360 close contacts have been sent to quarantine centers. 450 contacts have to be tested. Let's take we respect experts' opinions. Let's take an English question.
From RTHK, I have 3 questions. First, regarding the gym room cluster, have CHP investigate on the ventilation system in all the gym rooms involved in the cluster, whether they are all up to standard? And the second question is, have CHP estimate how big the cluster will be, and what are some of the 47 patients' occupation, whether they also work in the Western and Central District? And the last question is, did Dr. Chuang find it very challenging to contain this outbreak specifically? And what are the obstacles that CHP faces in terms of contact tracing in this cluster? Thank you.
The ventilation is not under CHP's purview. Maybe you would like to ask the licensing authority whether there is a requirement on the ventilation. But basically, person-to-person spread can explain the outbreak spread in this outbreak, because we understand from the clients, from the patients, that many of them do not wear masks while exercise, and many of them repeatedly go to the gym, and they either attend some group exercise, which may involve as much as more than 10 students, and also most of the staff has already been infected, so they have a persistent source in the gym that could spread the illness. Many of them, because the gym is in the Hong Kong island, so many of them work in the Central and Hong Kong district. So involve various occupations such as banking, finance, and lawyers, and various occupations. So this is challenging because there's a lot of cases pop up in 1 or 2 days. So they may have already went to various places during their social activities, because many of them also went to restaurants or sometimes bars to drink with their friends and gather at home, and so it is difficult to recall all these activities, and also we need to trace them and to find out who are them, and put them under quarantine or advise them to go testing. So we need the compliance and the cooperation of all the cases as well as the close contacts.
我哋答多個英文問題。
Let's take another English question.
In the South China Morning Post, Dr. Chuang, how alarming is the Ursus cluster, and is it likely that second or even third generation transmission is occurring? How many companies or schools are involved, and if possible, can you name them? Second question is, does the CHP recommend closing schools or gyms because so many people are linked to that cluster from those places? And I'd like to clarify, you mentioned earlier that a compulsory testing notice for fitness instructors will be issued. So does it have to be done before March 14th or inclusive of March 14th? So essentially before March 15th. Thank you.
For the compulsory testing notice, I understand they should be done on or before 14, if I understand correctly. But those who have been done, for example, yesterday, will not be counted. And we have already observed a small number of secondary transmission. I mean, second generation transmission among those who had not been to the gym, the close contacts of the cases. And it is likely that we may also observe third generations, even after putting them into the quarantine camp. And you may observe that I have not announced any building list today because the number is so large, both in the residential one and as well as in the workplace ones. So that would they would also need to undergo compulsory testing notice. So you have to look at the press release later. And I understand the Bureau will issue a compulsory testing notice for one-off. So I think this may help to find out if there are other asymptomatic infection among those other staff in the gym.
下一位嗰邊後邊嗰位男士。
Next question, please, the gentleman at the back. Good afternoon, I'm from Now TV. 3 questions. First, experts said that the customers would take off their masks to exercise, so there are more, they breathe more during the exercise. Since we have had substandard ventilation system in restaurants, do you think fitness centers should be fit with up to standard ventilation system to operate? And also before Sunday, staff at gyms have to be tested. Now, since restaurants were reopened on the 7th day of Chinese Lunar New Year, there have been a lot of people queuing up for a test. So do you have the adequate capacity to do that? According to the compulsory testing notice building list yesterday, many buildings are located in Central and Western. Previously, Yao Chim Mong districts were ordered to be closed. So do you think Central or Western has to be closed off to contain the transmission? I'm not an expert in terms of air exchange rate of ventilation system, so you may have to ask the experts for that. The Food and Health Bureau is prepared to carry out the test. Our testing capacity is able to cope. Of course, besides testing center, members of the public can also get a bottle from different stations. In terms of closing off an area, it is up to the departments and bureaus.
TVB, we see that on this occasion there are 64 cases originating from Ursus Gym. So does that mean we're in the 5th wave? Have we entered the 5th wave? And would you consider this a serious outbreak? And for Dr. Yu, we see so many confirmed cases, and now you're saying AWE will be in standby mode. So can we handle a large outbreak in the short term? The gym is a serious outbreak because we have a lot of cases in a short period of time. So it indicates the spread has been going on for a few days at least. Currently, the Infection Control Center has 2 rooms in operation, and next week we will have another room providing 210 beds. The hardware is available, and in public hospitals we have 1,200 isolation wards and the usage rate is below 60%. If necessary, we can activate other wards, and in the worst case, we can redeploy the community facility. Cable TV. The gym has such a large outbreak. Will you tighten regulations and shut down all the gyms? So, a lot of industries are being affected. So would you say that we're not even in the fifth wave where it's out of control? Well, of course we cannot say it's under control. We're still seeing an increase in figures. We're still tracking the close contacts. So to what extent the outbreak will continue, I cannot forecast. So we will be providing a one-off test, and we won't rule out any other measures. So if we don't have any other questions, this will be the end of our conference. Thank you.